Health Minister Dr Aaron Motsoaledi is visiting the General de la Rey Hospital in Lichtenburg, Northwest. This is after the flooding incident at the hospital where 30 patients were moved to different hospitals across the Mulema district. This is the third hospital in the province to be flooded in a week. Similar incidents happened in Lihurutse and Moses Kotane hospitals. For more on the story, we cross to SABC News reporter Tebogo Phakedi. Tebogo, thanks once again for joining us. Has the minister arrived? And you had mentioned in the previous hour that he was also going to do a walkabout. Have you been able to engage with him?
Good morning, good afternoon, Diabo, and of course, good afternoon to the viewers. The minister is still in a closed session with the Department of Health as well as the management of this hospital, that is General de la Rey Hospital in Lichtenburg. If my colleague Tumelo Setlhabetsi can give you a wide shot of a pelting rain as well as pan towards the health officials that are really outside, showing that this hospital is not operating. It's been 2 days now following the floods that we saw Sunday evening or Sunday night. And of course, as you have correctly alluded, health officials, we are told, the patients, in actual fact, more than 30 of them sent to different hospitals across the Mulema district municipality. The flooding here at this specific hospital, the Department of Health said was due to the inflow from the water, storm water system in the Ditsobotla area. And of course, they have blamed the municipality of Ditsobotla, which is expected to man, these storm water systems. We saw all the 4 wards flooded. We were told that 3 of the mothers were in labor when they were transferred to Mahikeng Provincial Hospital. I just want to talk to Sanko in the Mulema region just to get their reaction. So I will speak to Bennett Masike, that is the regional secretary of Sanko. Thank you so much for your time. The hospital is not working. It is the only hospital in the Ditsobotla area. Just your reaction to this.
Thank you very much to the viewers and to everybody. We as Sanko, we are very disappointed because the cluster of Ditsobotla, let me just talk in simple terms. People from Gamotlata, Gamaloka, Lichtenburg, Buikutso, Bedeville, and Itsoseni, they are using this General de la Rey Hospital as their best hospital. Currently, the situation, it leaves our people in a dismay because they will have to travel as far as Mahikeng, Swaying, and Ramotsir. So we as Sanko, we are much worried about the extension of resources that are going to be burdened to our communities.
Yeah. Just your overview on the state of health facilities in the province, because this is not the first hospital. We also see Lihurutse and Moses Kotane. Of course, the Department of Health says this is due to the stormwater system, which municipalities really are not manning as far as maintenance is concerned. But we also were able to do an oversight inside, and observed how there's poor maintenance in this hospital. Just your overview as far as the health sector is concerned in the province.
You see, the problem doesn't start now in terms of the poor health system of our province. It started back then, during the era of Dr. Masike, and then from there it goes to Comrade Honorable Sambata. Now it's been extended to Comrade Lehari. This problem, it has been there for a very long time. The state of our public hospital, in terms of infrastructure, is dilapidated due to the following reasons. 1, poor management. Secondly, the corruption that is taking place in the department. Thirdly, a lack of human resource in terms of developing our people, particularly our nurses and staff.
Thank you so much. That is Bennett Masike, the Regional Secretary of SANCO here in Ngaka-Modiri-Molema District Municipality, expressing concern and disappointment over the state of the General de la Rey Hospital and other hospitals, as this hospital was flooded on Sunday, and of course patients moved to nearby hospitals. We'll hear from the minister once he gets out of the 2-hour closed session of a briefing, as he will be doing oversight here. Hear from him as to what is the Department of Health nationally saying regarding the state of the flooding as far as the hospitals are concerned in the province.